Hello, I'm Alistair at Everwell and I want to talk about shoulder pain today. We get so many people in the office with long-term chronic shoulder pain and they've tried all kinds of things, steroid injections, exercises, stretching, and yet their shoulder pain remains. I think the missing link is the fact that a lot of people completely ignore the fact that their thoracic spine, the spine is broken up into three sections. We've got the cervicals, which is the neck, we've got the thoracics, which is the mid-spine, and then we've got the lumbars at the bottom there. If your thoracic spine is not moving as well as it could or should, it throws you forwards. This head starts dropping forwards, these shoulders start rounding, all of this bit seizes up. Now, of course, if you're in this position, your muscles in the shoulder no longer have the leverage that they need to be able to perform the tasks that you're asking of them. And so, yeah, you're gonna end up with tendinopathies, you're gonna end up with strained muscles. It's gonna be a nightmare situation. So, if you've bombarded your shoulder with all of the therapeutic ideas you can possibly think of, but you haven't touched that thoracic spine, have a look at your thoracic spine. Get that moving more. Bring those shoulders back. Bring that head into a much more upright position. And I bet those shoulders will start to improve. So now we understand the relationship between the shoulders, our shoulder pain, and the thoracic spine. The next question is, well, what on earth can I do about it? Now, if you don't have an opportunity to see someone like myself, I'm a chiropractor, for those of you that don't know, and there's plenty of other therapists and therapy types that can help you with this as well. But if you don't have an opportunity to see anyone, there are some things you can start doing to move the conversation forwards. Movement is medicine. So the more movement we can get into an area, the better it will feel and the better our whole bodies will hold themselves and therefore equals less pain. So I'm going to take you through 3 exercises now. I call them exercises. Don't think of them as exercise per se. It's much more movement practice, okay? We need to develop that mind-muscle connection again. Now the first one is called threading the needle. It's a really nice stretch. We're starting off on all fours. Just get comfortable in that position. Try and find as neutral spine alignment as possible. And what I mean by that is you want your spine to be pretty flat. You don't want to be flexing up to the ceiling or down to the floor. You just want to be nice and flat. Now from here, we're stretching one arm underneath the body and across ourselves, and dropping down into that downward shoulder. Now have a play with this. There's no textbook position. You just need to play with it and find that kind of biting point where you feel that upper mid back really start to stretch, and then hold it there for a few seconds. Once you're happy with one side, cross over, move on to the other side. Again, have a play, find that bite point, drop down, and give that upper and mid back a nice big stretch. Now, the next one is the cat camel. Absolute classic, and it's a classic for a reason. It's really effective, okay? So again, in this position, soften the elbows. We don't want to be locking any joints up. Soften the elbows, flex up to the ceiling. Again, try and spread those shoulder blades apart as though you're spreading your wings. hold there for a few seconds, and then flexing down to the floor, dropping between those shoulder blades, and back up again. Pushing up through, spread your wings, hold there, and dropping down again. Hold there. Nice. And then the last one, let me grab an office chair, which I situated earlier. Now, those first two are really good for the upper and mid back, but of course we also want to target the shoulders as well, because they play a big role in all of this. So for that, we're going to use a chair, and we're going to use a chair assisted, I guess, thoracic stretch. Dead easy, kneeling in front of the chair, arms on a chair. Now, if you don't have a wheelie chair, that's fine, you don't need one. It does just make life a bit easier, because obviously you can move it around. From here, you're dropping down in between those shoulder blades again, and again you feel a nice big stretch across the upper back, and in this case, into the shoulders and the upper arm as well. Now, this is a really good one if you get sort of tingling in the arms and the hands. This is a really nice stretch for that, because of course you're also stretching out your big pectoral muscles as you drop down, and oftentimes tingling in the hands and the arms is a result of pressure on a bundle of nerves that sits about there called your brachial plexus. And so this can really help relieve that. So you're dropping down and through, holding for a maximum of 30 seconds, I'd say, but it really 10, 20, 30 seconds, whatever you're comfortable doing as a start. And of course, it's just your starting point. You can build from there. So those three exercises, threading the needle, cat-camel, chair-assisted thoracic stretch, will go a long way to helping this issue.